rock and roll, I think, as they say. So I'll call the meeting to order. And as per
recording in progress,
as per the open meeting law, we need to do a roll call at the beginning of the meeting. If you could just state your name. So Paula
Curran.
Carrie
Janelle.
Jerry
Kramer.
Kevin
Sexton.
Great. So the agenda tonight is, relatively modest. I think it looks like, as we put it together, mostly updates, informational type discussions, unless any other issues arise. So it's the perfect agenda for the dog days of August. So we're going to approve the minutes, do public comment. We're going to follow up on the rodent control discussion we had last June. And then updates on the community health needs assessment, the shared service grant, Reading Coalition, if there is any, and then the monthly health department report. So that is the plan for tonight. In terms of the minutes, were there any comments or suggestions about the minutes?
Apparently, we found 2 typos that we corrected, and you can see them on the screen, highlighted. So,
oh yeah, right. And I actually had a couple things I wanted to mention. So Cassidy, if you can unshare your screen, and I thought it might be easier just for me to show what I highlighted here. Okay, so in the public comment section, just for accuracy purposes, what Emmy Dove had raised was the CDC guidelines that were published on May 11th. So I just add that as more informational. You got the financial. And then these items here around what the health department would do was, since I made those suggestions, I think they were just suggestions. I don't think they were, sort of approved and directives. So I would sort of soften that to say that those were suggestions.
Right. There were, suggestions are kind of, we were brainstorming essentially.
Exactly.
Yeah.
Exactly. Yeah. And Terry and I had this little love fest here.
Yep.
But I think a better term than votes would be nominates. We ended up nominating each other.
Right.
And I think that was it. So those would be the only suggestions I have. So do I have a motion to approve the minutes from June 8th with those edits?
Motion to approve the
Second.
minutes from June 8th.
Second.
Can I second? I wasn't there.
Oh, you weren't there. You could. You know what?
You can second.
You can second.
Can second.
Yes.
Yeah.
Yep.
Okay. Roll call. Carrie,
Yes.
Paula,
Yes.
and Rick. Yes. Okay. The minutes are approved. Doesn't look like. Oh yes. We have one member of the public, Mary Ellen O'Neill. If she would like to make a comment, maybe you can raise your hand, or Cassidy, you can unmute her.
She is currently not muted. Yeah.
Okay, she's not muted.
I don't have any comments to make tonight, but thank you very much.
Okay, great. Thank you. Thank you for being here. All right, so next item number 5 is the rodent control follow-up discussion, and I think Ade is gonna take that one.
all right, Cassidy. So sometime in June, Mary Ellen and Nancy Doctor sent this article to me to share with the board. I know that I emailed it to the board, but I also want to officially share it on our Zoom meeting.
Sure.
And that this kind of this transition into the idea of going with ContraPest and eliminating Yankee Pest Control. So the good news is that we were able to secure everything we need for ContraPest, pretty much the rat bird control. We got the funding, we ordered everything, and I would pretty much like to show you what it looks like. So just give me 1 second, please. All right, so this is what the ContraPest bait station looks like, this entire thing. We have 2 liquid contraceptive tanks. We have 2 feeders right here. So what we want to do is place the feeders in the bait box, twist off the caps from the contraceptive tanks, and affix the tanks to the feeder. So that's the hole in the feeder. You twist it off, affix it, and twist it into this hole to make it rigid. Won't do that right now. This is just for demonstration purposes only. So once that's done, it's going to look something like this. And then the way this works is it goes gravity. So the liquid contraceptive drips from the tank into these 2 compartments over here. And so once that's done, we want to lure the rats into the bait station. We want to lure them into the bait box. And how do we do that? Here's the magic right here. I hope you guys can see it. So this is the attractant that attracts the rats and mice into this bait box. So this is specifically designed to lure rats and mice only. It doesn't lure humans. It doesn't lure bald eagles or other animals, just rats and mice. So what you want to do is remove the cap and apply this attractant to this section of the bait station. So once you do that, the rats and mice, they smell the attractant. They come in through these 2 holes right here, 1 and 2. They come in to eat dinner and then have some cocktails. And then exit. They exit through those holes. And as you can see, this is non-toxic, very easy to use, very manageable. It's not poisonous. I have it in my office. I'm touching it with my bare hands. There's really nothing to worry about. And then once that's done, you just cover it up and place it wherever you need to place it.
How long would that last, do you think?
So each tank, we're looking at about 3 to 4 months on an average, depending on consumption.
Mm-hmm.
So,
Activity, you mean?
yeah, the consumption
So,
activity.
so like during the summer, it might be more often.
Well, during the summer, the way it's we factored it is we're looking at 3 to 4 months in the summer. Wintertime, it's going to be more like 6.
Oh, I see. Okay.
So moving forward, we would only need to purchase these tanks and this attractant.
Okay.
So let me switch back to my other camera. Just hold on one second. All right. So again, the good thing about this ContraPest is it is very manageable. We can handle it ourselves. We don't need a pest control company to do it for us. We plan to replace all the bait boxes at Washington Park and Longfellow Drive. We plan to do those next week.
Great.
Also, Jennifer, our health inspector, has taken the initiative to label each box with our contact information, phone number, name, you know, and then she has volunteered to monitor the level of contraceptives in each big box. So pretty much Jennifer wants to own this, and you know, I'm very happy and thankful about that. So the good thing here is our contract with Yankee Pest Control will be terminated before the month is over. And we would be saving a lot of money. So,
Great.
you know, switching to this alternative approach compared to using traditional poison approach will not only prevent rats and mice from multiplying, we're going to see a lot of savings. So currently we're spending $245 a month on Yankee Pest Control for the 9 big boxes that we have. So if you multiply $245 a month times 12, we're looking at approximately $3,000. And everything I just showed you, we have over a year's worth of materials, and we only spent a third. We only spent $1,195.
Wow.
So we're saving approximately $2,000.
That's great.
Yes, it is. It is great news. And the good thing is we can manage it ourselves. You know, we can manage the levels of the contraceptives. It's not poisonous. You know, everybody's happy. The bodyguards are happy, you know. So I think it's a good thing for us.
That's great.
Yeah.
Sounds good.
A day, so you said we're gonna keep the placement strategy that we had in place of the locations that we'd previously identified as needing them and just use those. Is that right? Is there a different kind of assessment happening, or?
Correct. So we use those as the starting point.
Yep.
And since Jennifer has volunteered to own this, we can monitor everything that's going on better.
Yep.
We have she wants to go out weekly instead of monthly, and we can track everything on our graph, put the data out, and if we see areas that are underperforming, we can easily move those boxes to somewhere else that they can be needed. So again, I'm very happy because we have the opportunity to manage this ourselves. We don't have to pay anybody to do it for us. So I'm happy about that.
That's great.
Yeah, better data, better results, I believe.
And can I just ask a follow-up on the placement? Are they placed so they're labeled, and that's good, they're clearly labeled, but they're placed kind of in secure, safe locations and not like right on the sidewalk for somebody to trip over, or?
Correct.
I'm joking, but you know where I'm going. Yes.
Yeah, we're gonna treat them like they're like the traditional poison, but we all know that they're not. We know that this is safe, but we're gonna keep those precautions in place.
Okay, great.
Kevin?
Ade, just on the attractant, how is it like a sticky material? How does it prevent like one rat from coming in and sucking it all up, and then, other rats just aren't attracted over there? In other words, just from an efficiency standpoint, how does that food work?
Well, we will find out.
Okay. I love the idea. I think it's a great idea. I think it's a great switch. I'm just be curious to see how that all works.
Yeah, we'll find out. Let's
I'm glad to hear Jennifer will be doing a weekly, so that'll be good.
Yeah. We'll have accurate data for everybody. So
Paula?
I'm wondering how you're going to be able to monitor decreasing in numbers. Is just by reports, or how do you monitor?
So the way this works is, it's birth control.
Yeah.
So, we're going to monitor the activity of the contraceptives in each container, and that tells us the consumption rate. If it's not being consumed, it means, there's not a lot of activity in that area,
Okay.
and we'll move it.
Right.
And eventually, if we have a town-wide problem, we can duplicate this on a town-wide level.
Right.
So we can see this as a pilot study, maybe.
Well, right, yeah, absolutely. Sorry if I may.
Okay, sure.
Yeah, I mean, I like that, pilot, and I think, yeah, being, at the weekly, I really think it's a well-designed program. Assessing weekly gives you a good sense of activity levels. And if you're tracking that data, then you can show over time. You can match it to indications that you have of potential harborage locations. And I think that I like pilot, I think, is a great way to describe it, because then you will learn some things like Kevin pointed out about how do we, does somebody eat it all in the first seeding and there's nothing left for anybody else? And so yeah, I think pilot is a great way to refer to it, and it sounds super promising, and I look forward to hearing your results and your experience.
Sounds good. We look forward to sharing those results with you. So
Great. Thanks. Good solution. Great solution. Moving on to update on House Bill 2072. So this is the bill that would expand the board to 5 full members. And so I've been in touch intermittently with Michael Smith, who is the Deputy Chief of Staff and Communication Director for Bradley Jones. And the bill is in the process of going through the various legislative hoops, which remarkably, there are many, even though this is like a 2-page simple document. And so just so that you're aware, there was a hearing by the Joint Committee on Municipalities and Regional Government on June 20th. It reported favorably out. And then it gets referred to the House Committee on Steering Policy and Scheduling, which actually happened. And then Michael has been very kind and communicative as a communication director on this, but I'm just going to read from his email what the process is, just to educate us all on the legislative process. So he said there are several steps remaining in the process. The next step would be for the House to move the legislation to the House Committee on Bills in the 3rd reading, after which it would be subject to engrossment by the House, which represents preliminary approval. Once the bill passes the House, it will go through the same process on the Senate side, starting with the Steering Policy and Scheduling, then moving to the Senate 3rd reading, finally to be engrossed. Once both House and Senate have engrossed the bill, I'm not sure what engrossed means myself, it will be subject to final vote of enactment in both branches before being sent to the governor for her review and signature. So this streamlined process takes some time. And, it's funny, I thought I thought by last spring, this would be done. Given that process, I guess we're probably looking at the fall, I suspect, just to let you know, but it's moving along, which is good.
As long as it doesn't go to the committee on third reading.
I
If
am-
it goes there, we've got a problem, and that's like the wave the flag and get it out. We'll,
Do you know what engrossment means? What does that mean?
it's like signed and sealed. It would be notarized if we were talking about a notary. And then Kevin, does it go into the it has to be recorded in the I guess would it be in this the session general laws?
Love my pay grade, all that minutia.
Yeah, I think it's session. I think it goes in the session. So yeah, they got to make sure and tell all the people so that the left hand knows what the right hand is doing.
Yeah.
And it's a pain because it's such a, like you said, it's a small piece, but you can't make an exception for a small piece of legislation, because then you get into the debate of, well, what's small and how do you get it through? So everybody's got to have the same process.
Right.
Rick, did we mention, Rick, that it was unanimous at town meeting? Like, can we fast track it a little bit?
I think they know that, and they are trying, but boy, I did actually tune into the June 20th hearing, and there were, truth be told, there were like 30 to 40 things that they had to review, and so I guess there's a lot of volume.
The Massachusetts legislature has one of the highest, if not the highest in the country, volume of bills filed and reviewed. And
oh, really?
Yeah, it's a very, very busy legislature.
Yeah, I think we're only exceeded by New York. So we've got a lot of other big states beat.
Wow.
Yeah, there's a very active. And I think probably some of that goes to the fact that we have 351 municipalities,
Right. All right, so moving right along. Actually, item number 7, the community health needs assessment. I know that a number of us are on the advisory committee, and then if not, get CC'd on all the minutes and so forth. So in a nutshell, as I understand it, they've completed the 9 or 10 individual interviews. They've completed 5 focus groups of various groups of different demographics and so forth. We reviewed the community survey, which ADAE sent out again yesterday. So we reviewed that yesterday, and they're going to make some changes to it, but it's basically going to be going out both digitally and in paper. So it will be available at a number of places, the library, the Senior Citizen Center, potentially supermarkets and so forth, in town hall, as well as digitally online. And ADAE is going to work to get out the message that this is going to be happening. And I think the plan, ADAE, is maybe in the next couple of weeks it would get out there. So ADAE would work on making sure people are aware on the town website and social media and so forth. And then I think the plan is to run this through September, and then by the end of September, early October-ish, we should be in the stage of formulating the results from all this information gathering and, coming back to the board with, what it said, what we think, what we agree with, what we don't agree with, and take it from there. But the process seems to be moving along, efficiently. Yes, Carrie.
It's so first, I apologize for having missed the last meeting. I just started a new job and my calendars are a little confusing. But I agree, Rick, the process, I've been very pleased with what I've seen from the process from Pear Associates and the engagement. It's really very well run.
Yeah.
And nice to work with them. So you say the survey is going to be open for 6 weeks, 4 weeks? Is that what I heard?
A day, is that right? That's my sense was through the end of September.
About 4 weeks, I believe.
Okay.
4 weeks.
Okay. And is there a target of a number of respondents that we're going to try and get and we're all enrolled now, right? To be encouraging our friends and family to complete the survey, right? That's part of our job. But
I think there's a minimum of 100 is what the goal is, but
That was my recollection.
yeah, but that's really the floor. And
Yeah.
On the other hand, there's not an expectation, as I understand it from Jamie, that we would have, 5,000, 20% of the population. We're not going to have, we're not going to be able to get, those numbers, but a very reasonable sample.
right. And I assume that a good targeted outreach strategy for making sure that different demographics are
Absolutely.
represented so that we don't have skewed results based on only people like me with a kid no longer in the schools responding, right? We're going to
Right.
further try.
It's going to be a
range.
wide net. Yeah.
Good.
Can I ask a quick question?
Yeah.
A day, was there any thought of putting this out with water bills? We've done that in the past where we wanted something, put out the survey and or just with a QR code on it or something to the survey with the water bills. It's usually a piggyback thing and it doesn't really cost us much money.
Well, I believe they were concerned about, the cost of printing and paper and things like that. So they didn't think it was a financially stable option to do that, financially efficient option to do that.
We just saved $2,000, didn't we? Just saying. I'm just saying.
Yeah, we did. But
Well, the other option could be to send it out with the RMLD bills that go out, and it doesn't really have to be I think Jamie was concerned about printing paper surveys and stuffing it and so forth. It could simply be a flyer with a QR code.
Right.
But I just got my RMLD bill electronically a day or two ago, so it's monthly, so it might be a little bit late at this point.
Well, I guess I'll just go back again to saying I have been really pleased with the thought that the vendor has put into the outreach. Well, not the outreach strategy, I missed that part, but everything else. And they've been great at accepting feedback and so forth. So I'm gonna trust that there was some good discussion and there's some careful, thoughtful process to make sure that we get good representation.
And I think we need to monitor, maybe a day would be doing this, monitor weekly how many surveys we got. Because if we get to mid-September and we only have 86 surveys, we have a problem. I mean, we may need to change a strategy or do something.
Yeah. Oh, and you just gave me a great idea, Rick. And I don't know, maybe it's not a great idea. Is there a visual? Can we do like one of those thermometers of kind of what's the response level? Because that makes people curious. A day is like, oh my gosh, what is she saying now?
I'm open to all ideas. Everything is on the table.
I think Cassidy could put something like that on the health department website, and we could track it. I would be interested in seeing that actually.
Good idea.
Yeah.
There's also the street fairs coming up in a few weeks as well too.
We
We'll
need
have
a
a booth,
booth.
I'm assuming, right?
Yeah,
Okay.
we need a booth.
But yeah, I mean, I'm sure we could you could even distribute QR codes at that event.
Yep.
Yep.
Just have a big one on the booth.
Yeah. So we actually had a staff meeting today, and we pretty much decided not to attend the fair for a few reasons. Our original plan was to have people vaccinated and talk about, public health screenings and things like that. But unfortunately, we are, short-staffed at the moment.
Right.
And so we pretty much concluded not to attend this particular fair, but we can attend the new resident orientation
Mhm.
and some other events.
Oh, that's good.
Day, I'm sure we could partner with someone
Right.
like the Rotary or what are the other organizations carrying town? The Reading North Reading Chamber of Commerce, I'm
Right.
sure would allow us to have a flyer or a QR code put up. I think we can work around that one pretty easy and not have
Right.
staff.
That's a great idea,
Read my mind, Kevin. Yes. Who
Yeah.
else is going to be there that we can? Yeah.
I
Good.
know the coalition is going to be there, so we can have,
Oh, there you
Oh,
go.
Yeah, they
Perfect
would do
There
partners.
you go.
Yes.
Yeah,
yeah, and they can
Okay.
just scan it.
stack of
And what
flyers.
about, will the senior center have a booth as well, do you know?
I'm not sure about them, but I'll find out.
Or elder services or something like that?
Right, I would think, if you found out all the groups that are attending, you could pick out the ones that are most appropriate and give them a stack of handouts with a QR code, and it's worth a try.
Especially if the school's going to have something over there, if the superintendent's going to have something, that would be another good one to hit up.
Yeah,
I'm not sure if it's going to fit the timeline for the completion of the survey. Cassidy, do you know exactly when that fair is going to take place? Is it in November? or-
The
September
Street
10th.
Fair? It's September 10th.
Yeah, it's early September, second weekend in September.
Yeah. And the Rotary, not the Rotary, but the new resident is in October 3rd.
So actually, it sounds like the street fair is it matches with the
Timeline.
yeah.
Yeah,
All right, we'll make it happen.
thank you.
You're welcome.
And just one other note, I read and actually took it yesterday, that the Department of Public Health is doing a health equity survey for all Massachusetts residents. I don't think it will line up time-wise in terms of us being able to get that information as a separate data set to be part of the assessment process. But, we might be interesting to see those results, which I suspect wouldn't be in till the winter or early spring, but they may fold into, if they can provide it down to, a town level, it'll be interesting.
Yeah,
That's a fabulous segue to shared services, because that's a
Yes.
great question to ask the shared services folks. And I expect that it would be part of the same package that I've seen for other materials for shared services, the cart with the, demographics of the group and possibly the individual communities. So interesting to see.
Yeah. So segue into shared services, a day.
All right, so things are moving along with the shared services grant. The FY24 contract, the proposed work plan and budget have been submitted to the state, and they're all currently under review. So I know that I sent you full documents regarding the budget and the work plan. Here's a summary of the proposed work plan. We plan to hire a shared services coordinator that's completed. Her name is Annette. I invited her to the next Board of Health meeting, so she will be joining us. So everybody can meet her. We need to complete the intermunicipal agreement, the IMA. We're on track to do that. We actually have a draft copy that we're working on with the MAHB. We're on track to do that. We need to identify priority improvement areas based on the results of the capacity assessment result toolkit. We've not started that yet because we haven't received the results of the capacity assessment. We need to establish procedures for sharing of the health inspectors' time. We haven't started that yet. You know, we tried to hire an inspector a couple of months back, but we couldn't because the state did not approve the budget. So we had to do the budget over and turn it into the state. So we're waiting on approval at the moment. Let's see. And then we need to use the FDA standards to train inspectors. So our goal is to standardize everything among the 6 municipalities. The same way we have tobacco control grant standardization. We want to be able to make sure that inspections are being performed the same way across the board. So that's part of the standardization process. We want to make sure that inspectors are using the same equipment, that they're getting readings that can be comparable. We want to try to see like pretty much share data and share results. So for example, if we have a shared services nurse, that nurse should be able to go into Maven and get some epidemiological data from each municipality. Let's see. So, we have a bunch of things on here that we're still working on, but the good thing is we have a competent shared services coordinator that's helping us out. So I'm very confident that we're going to achieve these goals. Let's see, if we go to the budget, I'd like to share the budget with everybody. I turned in a full document to the board, but these are just highlights. So the coordinator salary is $78,000. We plan to hire a health inspector at around $70,000, a public health nurse at around $75,000. We budgeted $20,000 for other public health staff, such as interns and trainers and things like that. Fringe benefits, we budgeted that at 23%, which is equivalent to $55,890, and payroll taxes. So if you combine all those things I mentioned, we're looking at $306,180. We budgeted $20,000 for a consultant, and the goal of the consultant is to help us with the standardization process. We want to make sure that everything is standardized among the 6 municipalities. And I raised the point about, budgeting. If you look at line 17, we have other public health staff. So I raised that point that we already have other public health staff. Why should we budget another $20,000 for the consultant on line item 33? And pretty much the feedback that I got was that the state may not approve the $20,000 for the intern. So, and if they don't, we still have the $20,000 for the consultant. So again, this is just a draft budget. We're waiting for approval. They might come back and tell us to tweak some things or, do things differently. We don't know. We're just waiting for them to come back and tell us what needs to be done. For printing and translation services, we budgeted $5,000, $7,000 for inspection supplies, thermometers, things like that, laptops. Membership fees, $4,000 for new and existing staff. And nursing supplies, we budgeted $7,000. Hardware, technology hardware like scanners, copiers, things like that. We budgeted 5,500. And then technology software, we budgeted 65,000. And the reason we did that is in line with standardization. We want to make sure that we're all using the same software for food inspections.
Mhm.
So, for example, we use Food Code Pro, and then North Andover uses what do you call it? They use it.
Relevant? Is it
different-
relevant?
Relevant is what we use.
Oh,
but
okay.
they use, North Andover uses something different, and then another municipality uses something different. So if we want to standardize everything, somebody has to join somebody. So somebody has to give up their software to join us. And the good thing is Relevant Systems, they've agreed to merge all 6 municipalities and give us one contract for $65,000.
Good.
So currently I'm shedding out like $8,000 to $9,000 every year.
Yep.
And if we go under this umbrella, it's going to be free because the grant is going to cover it and I don't have to shed out a penny.
Yep.
So that's good news. $8,000 for conferences and mileage reimbursement. So, the inspectors and the nurses and the nurse would be traveling around. They have to get reimbursed for mileage, and that's why that's so high. So, we are like $2,000 to $3,000 under budget, and we're just waiting for the state to approve it. If they don't approve it, they'll make some recommendations. They'll tell us what we need to change, and hopefully we can get this approved and we can get our inspector and our nurse hired.
I just have a quick question.
Yeah.
Dave, if you would indulge me here on the budget. And normal budgets, if you come under, obviously goes back into the general fund for the next year and so forth and so on. How does this work with the grant? Does it just go back to the state?
Correct.
Okay. I'm just curious.
Yes. So again, we're working with the MAHB to come up with an intermunicipal agreement. That's almost done. I have a draft that I shared with the board. We plan to hold interviews. So we are anticipating that this budget will be approved sometime next week. And if that happens, we will be holding interviews for the public health nurse and the public health inspector positions during the week of August 21st. Let's see. And so far we have the ads out there. We've received 6 applications for the inspector position, and we've received 2 applications for the public health nurse position. So things are looking good.
And Dave, I may have misread one of the documents you said, but it seemed like there was maybe 3 public health nurses and 2 inspectors, or maybe I read it wrong. Is the goal, is the 1 public health nurse and the 1 inspector, is that the first year, or is that only what's envisioned forever, in the grant?
That's what's envisioned for now, based on the amount that we have.
Okay. And on the document, the Excel spreadsheet that had all the objectives and the sub-objectives and so forth, as you pointed out actually at the beginning, a lot of them have either not started or have gone way past their deadline. Is that because the state hasn't approved the budget yet, or?
Correct.
Okay.
The state hasn't approved the budget, so we're limited in terms of what we can do.
Okay. Good.
I think it's great that y'all are taking on the goal of standardization. It's a lot of work, but it's very worthwhile work, and it really changes things. So that alone is a wonderful result for all of the communities in the area. So was great, really great. My new role will include some shared services work and some regional field training hub work. So I have been playing with these things as well. So I great to see what y'all are doing. Looks good.
Sounds good.
All right, any other comments or thoughts? No. Any coalition updates, Kevin, or?
No, unfortunately, I was away that week, but there wasn't really much pressing in regards to the coalition updates. I know there's a couple of things that definitely is going to be a crossover between our two boards coming up there. I think I told you all this before. They're kind of doing a community assessment as well on their side of things. So I think that really is the most important piece between our two boards coming up in the next 6 months is to, and I think, is Erica coming out to either September or October meeting in regards to that? I thought there was some talk that she was looking to come out.
I'm not sure about that.
Okay, maybe she just hasn't reached out as of yet. I know she wanted to come before the board and talk and discuss a little bit about the between our assessment and theirs. So it just hasn't come to fruition on her side yet. But other than that, the one thing I will say about these meetings, it's interesting. When they first started out, it was a grant. So they weren't necessarily a entity of the government per se. So the board was a little bit more involved in decision making and what have you. Votes taken on what to do. These meetings have kind of now where it's more, they are paid employees now, where they don't need to take a vote of board members for action, which is great. Right, obviously speeds things up. They've really kind of become more informational. So there's a couple. I look at what the agenda is, and I pick and choose a little bit. And I was away that week, and I said, I'm not going to bother logging in, just because there wasn't a whole lot on there. So that's just something to keep in mind moving forward for anybody that does end up wanting to pick up that role. That it's good, but it's more of an update. And I think having her come to our board is more important when she really wants to collaborate with us rather than having me over there. So just some food for thought for the future.
Okay.
Kevin, why are we talking? Sorry, Rick. But Kevin, why are we talking about somebody else picking up that role?
I'm just saying for the future, there's no talk.
Where are you going?
I'm right here. I'm not going anywhere.
Okay.
I'm not going anywhere. I promise you.
Okay.
It's a threat.
Okay. I like having you. I can't speak for my other people, but I think we all. Sorry, Rick.
No, I think that's true. This has jogged something. Has Jamie reached out to Erica to get the data from the youth survey that was done last week?
I believe she has.
Okay.
There was email between them, back and forth emails, and they CC'd me on it.
Okay, good. Because that would be an important data set. Health Department monthly update.
All right. So as you all know, Mallory is no longer with us. So we're back to where we used to be prior to having Mallory around. So not necessarily a bad place, but I'm sure we'll be all right. I'm sure we'll be all right. So we had 7 animal control inspections last month. We had 3 food re-inspections. We had 1 food establishment complaint. This individual saw a mouse in the dining area of a particular restaurant in town. We had 1 temporary event permit issued at the senior center. There was a housing complaint on Main Street regarding the landlord not addressing multiple violations. Somebody found a dead mouse floating in a pool. You know, I'm not going to mention the name of the pool, but there was also a temporary dumpster issue. Yeah, it was a pretty slow and steady month, you know. So you know, we're going to start approaching the busier months pretty soon. So, but everything else, you know, everything else is going well.
Epidemiologically, in terms of has any issues there in terms of infections, COVID, flu, you know, other things?
And no issues. There's no real spikes or anything like that.
Okay.
Careful how you say that, please. It's going up. It's going. You know. Yeah. Exactly. You know. All the. It's. Yeah.
Okay.
Oh, we have we posted the job vacancy for the public health nursing position. So we're looking to fill this quickly. And I mean, I'm not going to just settle for anybody. I'll prefer not to fill it than just settle. But we're looking to do it quickly. So,
And that's full-time, correct?
correct, full time.
So I can spread the word.
Sounds good.
Mhm.
Sounds good. We need somebody energetic, and we need somebody that would actually be a community health nurse, meaning that, you know, we want the person to be out of the office more and, you know, meet people, like set up a table at Stop and Shop or Market Basket somewhere, a library, meet people, you know, give vaccinations and things like that. So that's what we're looking for.
I'd be interested to see. I know that, you know, there's a lot of public health nursing positions open as a result of these PHE grants, and you know, I'll be interested to see if that brings a lot of folks out of the woodwork. I think that's great. I hope it's. I'm taking the positive view of it. I'm thinking it's gonna, you know, expand the people expand their awareness of the great things you can do as a public health nurse.
Yeah, and the good thing is we're doing the interviews for the shared services nurse. If I find a candidate that we turned out and I think will be a good fit for Reading, I'll definitely bring bring her, or, you know, whoever it is, we'll just bring her here.
That's right.
Yeah.
Yep.
All right. Any other comments, topics, anything we need to address? Not seeing any.
Nope.
Go ahead, Kevin.
I said nope.
Oh, okay. And I would make a motion to adjourn. Do I have a second?
Second.
Second, Paula. Okay, roll call. Carrie,
Yes.
Paula,
Yes.
Rick, yes. All right, we're good for another month, and things will start getting interesting in the fall with the outcome of the health services, shared services, as well as the assessment, and
Yes.
Things will start to pick up.
Yes, and hopefully we'll all be able to talk to each other more. Or, you know,
Yes.
our
Right,
you know,
Right.
expansion will coincide with that.
that's right.
That would be helpful.
Yes, indeed.
Sounds good.
All right. Have a
Good
good night,
night,
everybody.
everybody.
See y'all.
Thank
Take
you.
care.
Voting
Great
stopped.
day.